about my clinic. I set it up because I was really frustrated with medical care as it is. So I wanted to tell you a little bit about myself, why I came to do this, and what my clinic is about, and why I love it so much, and why you and your clients might love it too. Do I hit the button?
I'm gonna work your slide.
Oh, great, next slide. So I grew up in the DC area as an Air Force brat.
Next slide, Justin.
It's thinking about
We're
it.
sharing too, sorry.
And I really thrilled my parents by going to the #1 party school in the nation for college out in CU Boulder. But it worked out because I knew I was a type A kind of person and I really needed encouragement to take time away from study. So having the mountains right there for skiing, for rock climbing, that's what I needed more than the encouragement to work harder. So I did do pre-med, and then all of my mentors told me, whatever you do, don't actually go and be a doctor, because doctors are all miserable. But it worked out. I found the love of my life, got to bring him along with me on my journey, and I became a middle school teacher outside of Denver for 2 years. I taught math and science and religion to a really, really tiny school, and found out that I love educating and teaching, but I also was like, oh, maybe I should try to go to med school. And then when the Air Force said that they would pay for me to go to med school, and I could be free of debt, that sounded too good to let pass. So I joined up, and I went to Kansas City for medical school. And then I did my first assignment in the Air Force out at Nellis Air Force Base in Las Vegas as my family medicine residency. And that was the first time that I really got to see day to day what the life of a family medicine doctor is like. And it was a lot of seeing patients every 10 minutes. It was a lot of staying through lunch and not working, actually getting to eat or do anything helpful for myself, more of just taking care of patients because they needed me. 10 minutes wasn't enough to take care of some of them, so I needed to work through lunch. It was a lot of staying late to finish my notes because that's how we got paid, through coding. And I mean, these doctors that I was watching, they went through all this training, they really cared about their patients, but they weren't home in time to put their kids to bed, let alone be home in time for dinner. And that's not what I wanted for my life. So I looked for a better way, and I heard about flight surgery. And with flight surgeons, it's a lot of family medicine, primary care, but for a very limited population. You get to just take care of air crew, air traffic controllers, and their families. You get, next slide. You get to spend time with them outside of the clinic and actually build relationships with them. And that sounded a lot better than having 3,000 patients that I never really got to know that would just come in and see me for the most essential parts of their life. And I got to fly. So that was really sweet. And that's what I did next. I graduated residency. Yeah, that's perfect. I became a flight surgeon and first went to an undergraduate pilot training base, which is where they teach pilots how to fly, out in middle of nowhere, Oklahoma, Enid, Oklahoma. And that was so much fun. I got to fly in all 3 of their aircraft. And then after that, I was stationed over in Zwickau, Germany, where I got to fly in F-16s, rough life, and AWACS and C-130s. But then I was thinking it was about time to separate and settle down and be near family. And I really didn't want to be a family medicine doctor and have that 3,000 patients that I was in charge of again. So I looked at the smartest man that I knew, my mentor from residency, who had retired from the Air Force as a family medicine doctor, to see what he was up to. That was the first time I heard of direct primary care. Next slide. So you know how you want to see your doctor. So you make the phone call and they say, okay, we're a couple weeks out, and you say, I have strep throat. What am I going to do in a couple weeks for strep throat? Or they say, you know, it's been a while since you've been into our clinic, so you're actually a new patient, and we don't have spaces for new patients for a couple, 6 months. I didn't know that I was a new patient. I didn't know that I was kicked out of the clinic. Or you try to bring up another issue at your doctor's appointment, and they say, you got to make another appointment for that one and pay another copay, and then maybe we'll have time to address that other issue. It's so frustrating. And it's not what the doctor's like either. And that's kind of what this picture is trying to depict, that the provider is in the blue and you're in the yellow and you're trying to interact with each other, but there's all this red of administration and insurance hassles that they have to follow the rules of that gets in the way of actually having a meaningful conversation with your doctor. The idea behind direct primary care is if you worked directly with your doctor instead of with insurance for those basic stuff, for primary care, that you don't have to jump through all those hoops, that it's not actually that expensive to contract directly with your doctor. And then if we need to, we can go and communicate with insurance about an expensive medication or expensive labs, something like that. Next slide, please. But also for about half my patients don't have insurance at all, and I have the time to arrange things for good cash prices, for imaging, for labs, for medications. And so a lot of people think this sounds too good to be true. A lot of people think that sounds illegal to actually just work with a doctor without insurance being involved. It's totally foreign. We're really used to this way of doing healthcare. And I promise it's not illegal. And the only thing, I'm not allowed to see folks with Medicaid. We're talking with the legislature, but Colorado is one of 2 states where we're specifically prohibited from taking care of Medicaid patients, which is terrible. It's so hard to find a doctor with time to spend with Medicaid patients. But anyway, it's a really cool way of working the system and allowing it to be more relationship-based between me and my patients. And I do arrange amazing prices for things like labs. Labs and imaging and pharmacies also find insurance companies to be a giant hassle to work with, and they have to raise their prices appropriately. They have to spend all this time and effort billing appropriately to get paid by insurance. So if you cut insurance out, the prices drop dramatically.
Wow.
What a normal panel of labs is so much less expensive through me. So I definitely have patients that want to get labs through their insurance, through TRICARE, no problem. I can order those. But for just a CBC, instead of sitting in line for 2 hours at LabCorp and then finally getting your blood drawn, it's so nice to just be in there anyway. I draw your blood real quick, you get out before your appointment's even over. Next slide, please. Similar things with medications. I can get them a lot less expensively than you can at Walgreens, and that way you don't have to stay in line. But if you want to use your insurance, I can send them to Walgreens for you too. That's one of the reasons I can keep my prices so low, is because when you switch as a doctor from an insurance accepting practice to just working for your patients through a direct primary care model like this, it shaves 40% off of your overhead. That's a humongous amount of staff that I don't have to hire and paperwork that I don't have to do. I even give my patients my cell phone number and email address for after hours concerns, because I've got time. I just want to take care of these people. I have a large number of patients that have VA and TRICARE, and I feel like it works really well together, because TRICARE is a decent system to work with sometimes, especially for little stuff. And same with the VA. But if I can take care of the little stuff, kind of like how you use car insurance. Car insurance you save for big accidents. You wouldn't expect your car insurance to cover your oil change or your tire rotation. Same with health insurance, I think. I think we should be saving our health insurance for big ticket items, but using my kind of connections to get much less expensive day-to-day primary care. It's surprising how much family medicine doctors are trained to do that we don't actually practice that much. When you only have 10 minutes, you don't have time to stitch someone up if the green beans got a little feisty last night. But I do. So I do incision drainage. If you've got like a boil that came up out of nowhere and the last thing that sounds good is sitting in urgent care with people coughing over you, to have that opened up and relieved. I do DOT and FAA exams for folks that have their jobs that need those exams. I do ear piercing because it's fun. So I love skin stuff, I do sports medicine stuff, I have a ton of casting materials that I am not using enough. Someone needs to break some bones in my practice.
Ow.
Right.
It's really easy for me to get like strep tests, flu tests, COVID tests, and just get those out to my patients and diagnose them because they want to know. So I can do a lot, and it's really fun because I like to dabble in all these different things. That's why I became a family medicine doctor, not just so I could diagnose colds and allergies all day, but so I could do all sorts of cool things. So my prices are as low as I can make them. I really think they're fair, and I try to make it really especially affordable for families.
Paul, it's only
I'm
$1 for you.
located up on Baptist Road. That didn't come through real clear, but the yellow is the I-25, and that's Baptist Road, and that's my office, and that's my website. There's a lot of DPC doctors in town though, and they're all wonderful. We just had dinner together on Wednesday just to support each other because it's such a wonderful movement to provide better health care for everyone than what they're currently getting. So if you go to any of those websites, are your different directories for direct primary care practices throughout the nation. If you want to find anyone, because really I would just rather everyone be in a DPC practice and getting amazing medical care than being in the regular system. Thank you so much for your time. Does anyone have any questions?
Do you only see military?
Definitely not.
Do you cover, I saw up there like, chronic conditions, so like rheumatoid arthritis, fibromyalgia?
I have time for that. And I can send people to specialists when it gets over my head or when they need the expert opinions by all means. But a lot of the times what people really need is just the day-to-day, let's check your lab to make sure this medication isn't hurting you. How are your symptoms doing? Do you need to go back to the specialist or not?
You do hormone therapy? Oh, sorry.
I do
All
that.
that?
I don't like pellets because you can't, if you overdose, you can't take it out.
Yeah.
But I like it otherwise.
So
Yes, Ed?
are you linked, like, when you do the labs for your patients or for, former military, are you linked also with the VA so that they can see what your lab results are?
I'm not really sure. Does the VA have access to Quest labs?
That's a good
I
question.
have no idea. If they do, then I do. If not, I always email all the results to my patients anyway, so they have a copy of all of them that they can download and keep forever, so that's always a good option too. I love patients being in charge of their own records.
What's your turnaround on lab results?
Next one. Complicated labs take a little while,
Yeah.
but yeah, regular stuff, I love it. So cool.
So you do the labs and stuff on site, you do them?
I do.
Do you
I
have
learned how to draw blood.
X-rays and,
I don't have an X-ray machine.
uh-huh,
Usually Colorado Springs Imaging has the best catch rate, so I tend to favor them, and they have a walk-in policy.